therapy in MS is very interesting, right? So when I was medical school and training, and I'm like, I never thought we're going to have, kind of actually cell therapy that is advanced in clinical trial testing. And when we think about cellular therapy, we can think about it from different aspects. First thing come to mind when people think about cellular therapy is, stem cells and to that point. And then we know there is a hematopoietic, stem cell transplantation, and which is, more of a bone marrow type involving chemotherapy, which is an induction regimen followed by, or we call it induction regimen, or we call it kind of a group of chemotherapeutic agents that can be used, and then stem cells can be given back. It's autologous from the same patient, and then see if we can actually hold the disease, long term. So conditioning or induction or conditioning followed by transplantation. So that's in advanced clinical trial. There is a major trial, it's called BEAT-MS, and this trial is ongoing, right? It's in phase 3 now. And this is going against best available therapy. So that's one of the aspects that we kind of think about in the future. The other aspects of stem cells are actually whether you can use stem cells for some aspects of regeneration and kind of restoration, right? I think this is still in earlier stages, and establishing its safety is very important. And that's, I think, is moving also. We know that there are some studies that are showing safety of some of these interventions. I want to make sure that our colleagues and everyone who's watching is to know that it's important to make sure if any stem cell or any cellular therapy is being administered, that is being regulated. It's very important to know that, it's part of a clinical trial or part of a regulated procedure, a regulated thing, because we don't want, our patients to sometimes, go for some hopeful approaches that may not be regulated. I think this is an important aspect to keep in mind. The other arm of cellular therapy, which is now growing and in advancing in clinical trial, is a T-cell based therapy, which is cytotoxic T cells that are targeted for Epstein Barr virus infected B cells. And those type of interventions are of interest. Now, that's kind of coming closer to what we call it, targeted therapy, right? So we're targeting certain cells. Those cells we think may be driving the disease. That's the theory, right? And we think if we're targeting them, if we're eliminating them through cell-based therapy, that we may actually have, favorable effect on progressive MS. So that's one of the aspects that they're looking at, progressive MS using T-cell targeted therapy. Which is, now advancing in clinical trials. It's phase 2 now. So this is something that I think it is a good outlook for the future, that we are thinking this way, that we are testing this way. Patients enrolled in those studies, are also, contributing to the advancement of science and our understanding of MS. So this arm of cellular therapy is growing. It's still early, right? In stages, we still don't know the full efficacy, the full safety profiles, but we will know in the near future. So that's the thing that excites me, is we are going to know whether this is going to work, whether it's safe, whether it's going to have a beneficial effect to our patients. But again, it's excitement that we are, using cellular therapy it's been used in the past, right? People have used this type of therapy in the past. But now it is a regulated type of, I would say regulated type of studies, large scale studies, and again, promising. It's promising types of, scientific, approaches to treating multiple sclerosis. So again, very hopeful for the future. I think there's so many things that are really going very well in the MS field, and specifically in therapeutics, but also diagnostics and, chasing the cause of MS. That's another very important aspect. And I think, one day, targeting, even preventing MS from happening is going to be the huge impact on the society and on globally on every kind of people at risk for this disease. So this is very, very important. I think that, again, as I started, I said the future is bright. I conclude with actually the future is very bright.